Unit 3, Home Management. When you go into someone's home for home health, you will usually have a plan, and these plans are to be followed, but always remember you have to have some flexibility in those. Share the plan with your client and the family. Things to remember though, even though you are in a home environment, you still must have infection control. And what is the #1 way to stop the spread of infection? You know this. Wash your hands. Hand hygiene. Washing those hands. Same as being in the hospital, same as being in a nursing home or wherever. Hand hygiene, hand washing, #1 on controlling the spread of infection. All of your standard precautions apply, just like they would in any other setting. Always remember to eliminate safety hazards. And sometimes when you walk in homes, you're like, oh my gosh, there's so many safety hazards. For instance, throw rugs. For instance, things in their fridge, like things that have been there for months. There might be situations where they'll have cords, oxygen tubing going all over. You walk a fine line between taking over and decluttering everything and making places for people to walk and going through that fridge. That might get you some trouble and definite pushback from your client. You're going to have to learn how to work with them on things. One of the common things that I see a lot are refrigerator issues. Sometimes these folks will have Meals on Wheels deliver lunches, and they'll eat quite a bit of it, but not all of it, and they put it back in that little styrofoam container and put it back in the refrigerator, and the refrigerator is now full of those little styrofoam containers. And you start going through those and you're like, oh my, some of them really look a little scary, might be weeks old, and they're like, oh, don't throw that away, that's still good, I just got that. So one thing that you might learn how to do, here's a few tips for you. Every time you come in, once you get the refrigerators organized as they let you, then start rotating stock. First in, you know how that goes, last out type thing, rotating the stock. Sometimes it's being a little bit clandestine and just kind of, I hate to say the word sneaky, but if you can kind of sneak out, throw away a couple things that are visibly rotten. Remember, we lose our sense of smell as we age as well. They may not be able to tell. And sense of taste. 50% of our sense of taste is gone, the sweet and sour especially, sweet and salty, by the time we're 70. So they may not be tasting or smelling very well. You may not realize, and some of that might be pretty dangerous. Another thing I've done is once I saw, and it was visibly not good anymore, and my client said, oh, don't throw that away, I'll eat it, and I thought, oh, she can't eat this will make her very sick. And so I said, oh, okay, I was gonna take it home to my kids, they love that. Oh, well, go ahead and take it home, honey. Oh, you want to take it to your kids? You take that home. Take another one home, too. How many kids you have? Take one for each. I mean, then, of course, I let my supervisor know and told them the story because I didn't want them to think I was taking my client's food, but it was just a way to get some of the obviously rotten food out of the house, because sometimes it is hard, especially if they have a little bit of dementia and don't realize it and believe that it's still good. But you will walk a kind of kind of a fine line. You don't want to go in there and take over, but you do definitely want to provide a safe environment. And figuring out how to do that can be tricky. Another thing you'll see them do is they like to save things. They don't want to throw things away. And some of the things are kind of funny. Of course, there's, the margarine, the butter containers, and then what's another one is foil. I had a lady who had a stack about that big of used foil. And I've seen, those styrofoam things that meat and different food. It's a styrofoam plate type thing, and then they have the food, and then it's wrapped in clear wrap. She saved all those, and she had a whole cabinet full of them. Egg cartons, all kinds of stuff, just full. And that's okay. That's not hurting anybody. If it fits in a cabinet, go on. Not your battle to pick. But if it is something like, I had a lady who got 2 or 3 different newspapers and 3 or 4 different magazines. I don't think she has ever thrown any of them away. And they were stacked. I mean, like high, tall stacked. And she had one of those old floor furnaces, that were gas, where the fire, and she had a stack of them on the floor furnace. And now that was a battle I was going to pick. But I decided to say, oh my goodness, because she was very picky on anybody moving anything. I said, oh my goodness, look at that. We just need to, don't touch that. And I'm like, oh, I wouldn't. It's just, yeah, that's the floor furnace, and it could start everything on fire. I'm just asking 3 inches. And I got her permission for 3 inches, and I think I moved it 5 just to get it away from that floor furnace. Those are the kind of things you need to worry about, okay? Things that can be very dangerous, okay? Trying to hold down any kind of hazard. Another one might be a rug in the bathroom that doesn't have the sticky bottom side, or that sticky bottom side has come off and it's real slippery in there. That can be a big hazard as well. Watch for those kind of things and understand it's the dangerous ones you want to address, not the ones that are just, oh my gosh, why does she need 72 butter containers? It's all right. Let her do that. It's not hurting anything. Focus on the things that are dangerous.